I'm pleased to present to you Andy DiStefano, Veracity Logic's Director of Project Management. Andy?
Hello, and thank you for joining today. My name is Andy DiStefano, Director of Project Management at Veracity Logic. I have been in the biotech industry for 15 years and recently earned the ACRP Certified Professional Credential. I have a bachelor's degree in management and a certificate in clinical research organizational management. I will also be joined by two of my colleagues, Jennifer Coy and Kylie Zimmerman. Both are part of the project management team here at Veracity Logic. Veracity Logic is an IRT vendor specializing in small to mid-sized pharma. We have been designing and managing IRT systems in over 60 countries since 2005. IRT systems started out for the main purpose of randomization and inventory management in clinical trials. Although these are still the two key factors to an IRT, IRTs have expanded their capabilities. Today, we are going to focus on patient-reported outcomes as a feature of the IRT, which can be used many different ways to benefit the management of the trial. Today, we will cover what are patient-reported outcomes and when are they used, what are the benefits of using electronic versus paper, how can you use an IRT to record patient-reported outcomes, and how do you get started? A patient-reported outcome is a measurement of any aspects of a patient's health status that comes directly from the patient. In other words, without the interpretation of the response by a physician or anyone else. Data generated by a patient-reported outcome instrument can provide evidence of a treatment benefit from the patient's perspective. The patient-reported outcome instrument effectively measures the concept that is being studied. For more information, you can download from the NIH website at the link below. Here are some examples of how patient-reported outcomes are measured by questionnaires, diaries, surveys, and wearable devices. On a questionnaire, statements are listed, then the subject must select the best option which applies to them. For example, I look forward to visits with my family members. The options are the same as I used to, less than I used to, much less than I used to, or rarely. For a diary, for example, it might say, "Did you take your medication today?" And the responses would be yes or no. If yes, enter the time of day you took your medication, and if no, what was the reason? On a survey, an example of this is where the CDC is now texting a survey for anyone who has received a COVID-19 vaccine. Just a few simple questions to give feedback regarding possible side effects. And wearable devices, for example, track heart rate and body temperature. It is reported that 30% of all trials use patient-reported outcomes as primary or secondary endpoints. The protocol will indicate whether a patient-reported outcome measurement will be used in the clinical trial. The sponsor is responsible for the best practices in developing the patient-reported outcome itself, which include relevance, literature support, ease of use, and overall quality. The FDA has published guidance for industry dated December of 2009. Electronic data must meet the same fundamental elements of a data quality and integrity expected of the paper records. The vendor will work along with the CRO or sponsor to design the required functionality in the IRT. The patient enters their information into the survey, diary, or questionnaire. Patients make their entries by using their own devices, like mobile phones, tablets, personal computers, or calling into the IVRS phone system. Patients using their own devices keeps the cost of the project down significantly. The information can then be used to determine eligibility for randomization or transferred to the EDC or simply stored for reporting purposes. When you have a chance, take a look at the checklist published on this screen as was on an abstract on the NIH website. It includes pre-implementation, implementation, and post-implementation sections. Additional checklists can be found at the NIH link below. The graph on this slide shows that electronic patient-reported yields higher quality data than paper-based, and that ePRO elicits significantly greater subject compliance, sometimes as high as 97%. It could also lower your cost by over 40% if your company has never switched from paper diaries. Here is Jennifer Coy to continue the presentation.
Here are some of the advantages of using electronic patient-reported outcomes. More accurate and complete data, improved protocol compliance, avoidance of secondary data entry errors, easier implementation of skip patterns, less administrative burden, high respondent acceptance, reduced sample size requirements, and potential cost savings. If your company is looking for the greatest cost savings, encourage your team to have the patients use their own devices. The patient can use their own mobile phone, tablet, laptop, or telephone to make all of the required entries. Compliance with self-reported data entry requirements can be improved by sending text alerts at a specific time each day, sending follow-up texts if the entry was not made after the first reminder, and sending summary reports to the site coordinator, which will list which subjects did not make a diary entry the previous day. The site coordinator can then reach out to the patients to find out if they need any assistance in order for them to get back on track with the expected diary entries. The ePRO has the same development lifecycle as your IRT. It starts with gathering user requirements, followed by the programming and any other specifications required in your SOPs. The vendor will first validate the system and then turn it over to the CRO and sponsor. Once approved by all teams, it can be released into production. Depending on your IRT vendor, they may need an extra 2 to 3 weeks compared to just developing an IRT without ePRO. Each vendor will differ in their timelines. One of the biggest advantages of using an IRT for the patient-reported outcomes is that it can help prevent errors made at the time of entry. The IRT is smart enough to tell the patient if the patient is too early or too late to make an entry. If the patient enters an outcome that is inconsistent with other responses, it will produce an error message and ask the patient to re-enter a valid response. Another advantage is that the IRT can be used for determining whether the patient is eligible for randomization based on responses which have been entered in a daily diary. Let's take a look at an example. The protocol states that the subject can only be randomized if they meet the following 3 criteria. The subject has completed at least 5 entries in the last 7 days, and the subject has completed at least 90% of the diary entries since the date of screening, and the mean worst itch NRS score is 5 or greater. If the responsibility was left up to the site coordinator to calculate the above criteria, human mistakes would be inevitable. If a subject was randomized but subsequently found they were not eligible, the subject would have to be discontinued from the study. And now I'll turn the presentation over to Kylie Zimmerman.
Here are the features if you are part of the clinical team. Real-time dashboard results and percentage of compliance. Results can be kept blinded. Results can be emailed to the clinical team. Safety alerts can be sent to the medical monitor. And an email can be sent to the site listing any patients who have missed any entries. Let's take a look at a few examples of what the dashboard would display for the clinical team. If you are running a sleep study, then the diary data points might look like the table below. Some of the data points you might need are time of day when the patient woke up, the quality of their sleep, and a reason why the medication may not have been taken. If you are running a pain study, then the diary data points might look like the table below. Some of the data points you might need collected are average pain and worst pain scores. If you are running a dermatitis study, then the diary data points might look like the table below. Some of the data points you might need collected are, was the patient fasting? Did they apply the emollient? And what was the itch score? Let's take a look at the formatting options available. For web entries, radio buttons or checkboxes. Numeric scales, 0 through 10, with 10 being the worst pain the patient ever had. Multiple choice, decision tree type questions, and sliding scale. For telephone and traditional IVR format, press 1 to make your diary entry for your morning medication, and press 2 to make your diary entry for your evening medication. Here's an example of what a sliding scale would look like, available on a web page. Questionnaires that are copywritten can be replicated on the IRT web page. Electronic questionnaires make data collection more efficient than paper record entries. Take a minute to look at a sample list of questionnaires used for a dermatitis study. A few decisions have to be made to get the planning started. How do you want the entries made, via the web or telephone? What bring your own devices can be used? Is the study being run outside the US? If so, are translations required? If patient diary is included, start to draft questions. Give the vendor an approximate idea of how many questions will be asked and how many times per week does the subject need to make entries. If questionnaire, is copywritten version available or draft design? If wearable devices, does any data need to be integrated with the IRT in order to determine eligibility? Veracity Logic has been an IRT provider in the clinical trial industry since 2005. But did you also know that Veracity Logic offers patient diary and patient-reported outcome modules? While diary and ePRO vendors base their fees on total number of entries the patient makes throughout the study, Veracity Logic has a different pricing structure that could lower your diary and ePRO costs by over 40%. And if your company has never switched over from paper diaries, the cost savings could be even greater.
Many thanks, Andy, Jen, and Kylie, for that information for our attendees today. I welcome questions that any of you may have for the three of them. As you are able to post those, enter them into the question section, and I will pose those to one of our presenters for an answer. So if you have a question, please enter that in for us, and we will gladly ask that and get an answer for you here on the webinar. All right, Andy, here's a question for you. What options are available if a patient makes an incorrect entry?
Okay, yes, actually, for the most part, changes to the patient-reported outcomes are not made in the industry. However, if the sponsor decides that change is required, the IRT can be updated.
Excellent. And another one. See, I know you talked about the data being displayed on a dashboard, but what if we need the data on a report like Excel? Is that available?
Yes, all of this stored data is readily available in a spreadsheet format, and we can also work with your company if a customized report is needed.
Wonderful. There's definitely the fantastic options available within the ePRO. Let's see if there are any other questions. Please enter them in. We'll give you a few more seconds to type away if you do have a question for our panelists. All right, looks like we've covered the questions that were submitted. So if you do have questions, please feel free to reach out to us at Veracity Logic. We are happy to answer those for you. Again, I want to thank our presenters, Andy, Jen, and Kylie, for the information that you shared today, and a big thank you to the attendees who joined us to learn more about patient-recorded outcomes and the benefits of using ePRO for patients and clinical teams. We will place this recording on our website, and I will email the attendees a link directly to that, so you can go back to those slides where Andy had presented some websites, and you can go to those for additional reference materials. We thank you at Veracity Logic. As you know, we are available to be your IRT provider and your resource to assist with your next project when you have one that has a need. We are welcome a discussion about your ePRO needs and are happy to schedule a demonstration of our IRT system anytime. So all the best to each of you, and thank you for joining us.